fractured.
Right, so we're looking at Kyle Punch's hand, and he fractured this metacarpal right here, the 5th metacarpal, and he was punching and got a little fracture. And as you can see, it's still a little swollen. He has been in a cast, and it just came out of his cast, and he doesn't have full range of motion of this hand. So we are going to work on getting range of motion, which doesn't feel too good. So we're going to work on that. We're also going to work on his strength. Kyle is right-handed. He doesn't have very much strength in this hand after being in a cast for so long. So we have to work on increasing his strength. He'll do some squeezes, getting back to playing some baseball and some golf and all that good stuff. So we'll work on all kinds of exercises for his hands. So one exercise we can do is squeezing your hand. Go ahead and squeeze and open, and we can get a little ball, and we'll work on that as well. The range of motion in his wrist is actually okay. It's pretty good. So we really just have to work on his fingers. And he's going to do quite well because he's young and heals quickly. So.
I'm Carly Punch, and I jammed my toe and sprained my ankle.
Alright, and again, I'm Krista, and we're working on Carly's ankle. She twisted her ankle and has difficulty with walking and doing her school activities. She limps because it hurts to put all of her weight on it. So what we're going to do with her, since she did that, is mostly she's going to have to rest and elevate and ice. But also we need to decrease the swelling, and the ice will help with that. And also to keep her range of motion, we're going to work on her range of motion on a daily basis. She'll go up and down, trying to get that in, making some circles with her foot. Just trying to do it as far as she can, not forcing it, but just trying to keep her range of motion as she can. We need to get her back mobile so she can go return to school without any problems. In this toe, with the fracture on her toe, we don't do a whole lot for fractured toes. Usually we just kind of do the buddy system, maybe strengthen this ankle a little bit, and usually this baby toe will pretty much do well on its own without any interventions at all. So we're really going to focus on Carly's ankle and the swelling, doing some ice, like I said, range of motion, and then gradually some strengthening in that ankle. Alright, and again, I'm Krista Cass, and of course, physical therapists also hurt themselves. I actually tore my gastroc by demonstrating to a football player how to jump. And I felt a huge pop in my calf. My muscle tore away from the bone. It is now pocketed about right here. It's got a little knot right there. It looks like a little Popeye right there. I have this nice taping on my calf. It is not only helping with positioning of my foot so that I can walk a little bit with not much of a limp, and also to help pull the skin away from the injured area to allow increased blood flow. This is called kinesio tape. Kinesio tape is used a lot with athletes. We use it for all kinds of different reasons. For positioning, if you watch the Olympics, the volleyball players all had the kinesio tapes on their arms, repositioning their shoulders. Use it for all kinds of injuries. It's working very well with me. At this point, I've only done this Monday, so it's only been a couple of days. We're really focusing on decreasing the inflammation at this point because it is a soft tissue injury, and it will decrease swelling within a couple weeks. I have gone from crutches to one crutch, and now I am just having a bad limp. In the next couple weeks, I will continue to work on strengthening of this calf and getting rid of that limp, hopefully within the next 4 to 6 weeks. There you go.